Mexico has registered its first case of COVID-19 in a baby with an 8-month-old catching the virus from his mother. Now, many mothers in Mexico are isolating themselves in order to avoid possible infections. Valeria Leon brings us this story from Mexico City on how the health crisis is affecting mothers and their babies.
For the second time in less than a month, Matias tested positive for COVID-19. His mother, Mariana, was infected in Spain. She passed the illness onto her son when she returned home to Mexico, making him the first baby with coronavirus in the country.
Matías started with a fever and a cough. My baby was hospitalized, and after 2 days, his symptoms started to improve. The treatment they gave him was a mixture of anti-parasitic drugs and a medicine used for people with leukemia.
According to Dr. Carmen Espinosa, reports that children were somehow immune to the virus have been extremely detrimental.
Unfortunately, people started thinking that babies were immune to the disease, and this has resulted in people not taking adequate measures. Mexico is at a crucial point where things can be done to improve the future or let them get much worse.
Mexico's health authorities have focused little attention on the vulnerability of this age group. I asked Cristian Zaragoza, director of Mexico's Epidemiological Information Bureau, if there was a plan to deal with the potential rise in cases of infected babies.
There are some phone numbers where women may ask for help, specifically for young women and teen mothers, some sort of orientation on this matter. I really don't know in detail what the phone numbers are, but I am sure they exist.
After being criticized for not taking the pandemic seriously, the federal government announced a social distancing campaign. Local governments have started taking stricter measures. Here in the capital city, the mayor ordered cinemas, museums, and other social venues to close to the public. There is a potential for COVID-19 to be devastating in Mexico due to the high rate of existing health problems among the population.
Mexico, as opposed to other countries, has an extremely high rate of type 2 diabetes, an obesity rate linked to hypertension and to respiratory issues. So its people are at a much higher risk.
More stringent measures are expected to be announced in the next few days, with coronavirus fatalities doubling in just 3 days. Meanwhile, Mexicans can only wait and see just how bad this health crisis will get. Valeria Leon, TRT World, Mexico City.